All right, we're live.
All right. Good morning, everyone. Thank you. Welcome to Public Health and Minority Health Disparities Subcommittee. Thank you for being here early. We don't have a lot of bills today. I think we're going to try and get through this quickly so that we can get you all to some breakfast before our long day. So with that, let me go ahead and start with House Bill 318, Maryland Medicaid Assistance Program, Provider Agencies and Personal Care Aids, Reimbursement and Wages. Erin Hopwood, if you can talk us through the bill.
Okay, you've been provided a reprint that incorporates amendments offered by Delegate Bagnall, who sponsored the bill. The bill is introduced, provided for a wage increase, a mandatory wage increase that has been stricken by the amendments. Then if you go to bill page 2, beginning on line 30, the bill requires that on or before September 1st of each year, beginning in 2024, each provider agency must submit to the Maryland Department of Labor a report in the form and manner required by the Department of Labor that is an annual cost report, that is an annual report that includes documentation of the provider agency's average wage rate for personal care aids and any other information that the Department of Labor determines is appropriate. Then if you go down to after line 28, this is new language requiring the Department of Health to work with affected stakeholders to update the report that's submitted to the department under section 2. This is a current report that's already submitted to the department that was enacted in 2018 that compares the rate of reimbursement versus the actual cost to provide personal assistance services to individuals under the community first choice, community options, community personal assistance services, and any other home and community-based services administered by the department. It requires them to also develop a plan to close any identified differential gap in reimbursement rates. And while developing this plan, determine the amount of any adjustment needed in reimbursement rates to increase wages and benefits to personal care aides.
Thank you, Erin. Let's go ahead and move the amendments.
Move the amendment.
And then we'll discuss.
Move.
Do I have a second?
Second.
All right. Amendments have been moved and seconded. I want to open this up to the members and also to the advocates who have been working steadfastly on this issue. I know we are frustrated that we don't have a rate increase remaining in the bill, but we're trying to get to the right data reporting to make sure that we've got our dollars correct. So Delegate Hill, go ahead.
Oh. Thank you, Madam Chair. Elevator speech, what is it doing and why is it doing it?
Would you please?
Oh.
Sorry, Terry, it's my sorry.
Erin, do you want to speak to that? You want me to go ahead?
I mean, I described it. You can, I think she just wants a plain language summary.
Yeah,
So
the plain language summary is that we are moving the correct reporting under the correct agency because the original request was for the Department of Health to do some of this reporting. It really should be done by the Department of Labor. Department of Labor has the staff and the expertise required to get to the data reporting. And then we're also requiring the Department of Health to update their reporting on the wages so that we are comparing like to like so that we can get to the correct calculations so that when we are reimbursing our RSAs and they are reimbursing their home health workers, we're making sure that we are stabilizing both entities.
So this will or will not address, or it's separate from the contracted employee. This is in essence, is this a wage theft correct classification bill, or it's not? And we're just going to be doing the reporting so that we can then look at the numbers and someone's actually going to look at the numbers and look at the reports of each agency to see what they're doing. What you understand what I'm asking?
I do. And Dana, do you want to speak to that or Dave?
I'm happy to, yes. And thank you, Delegate Hill, for that question. So this is separate from the classification issue that's in the other bill. This is really about trying to make sure that the Department of Health and the state generally has all the information it needs to determine what an appropriate reimbursement rate is. Because right now it's just sort of setting rates without doing the data collection to figure out what home care agencies need and what home care workers need. And so this reporting would empower the state with that information so it can figure out what an appropriate rate is and what workers should be getting in comparison with other states.
And if I may, Madam Chair, so Dave, since part of the issue is that it's a pass-through and the agencies have to make a profit of some sort, talk to me about how knowing what folks are, what part of the reporting is saying that they're making a reasonable profit, and that if we don't raise the rate, they'll be okay. And if we do raise the rate, that they're going to pass through a certain amount. You understand what I'm asking?
Yeah, absolutely. Thank you. So part of the reporting is that RSAs will report workers' average wage rates, but the Department of Health has to do a more comprehensive study to determine what all the RSA's costs are. Labor is a big part of their costs, but it's not all of it. There are other significant costs. And I know Ms. Kaufman worked in good faith on the language, and I'm really grateful to her for doing that, because I think the language in the amended bill is really strong and comprehensive. And if the question sort of relates to making sure all RSA's costs are covered, which I think is a great question, I might sort of ask Ms. Kaufman to address that, if that's okay.
Absolutely. And Dana, go ahead.
Sure. Thank you. Yeah, so I think it's the way we have to look at it is first we have to figure out, again, what the costs are by updating the 2018 report, since there has been so much happening with COVID and inflation, to make sure that just our baseline rate is adequate. And then after we do that, we have to figure out, okay, now where do we go from here in order to be able to increase the home care workers' wages so that we can actually have a robust workforce and be able to recruit and not lose them to the big box stores. But until we know what this is, it's hard to actually be able to get us here. So I think that is what the first report is doing. And then for the Department of Labor report, I think that is just a subset of information that the Department of Labor can collect to help the Department of Health get to where we need to be.
So it's trying to get the business model right for all players.
Correct.
Exactly. Thank you, Delegate Hill. That was much more articulately stated than I did.
Madam Chair, I forgot one key.
Yep, go ahead.
Go
ahead, Erin.
In the reprint, the information, the cost report that's required to the Department of Labor on page 3, lines 12 through 14, this would have to be signed by an authorized representative of the provider agency under the penalty of perjury.
Yeah. And
go ahead, Dana. You were going to speak to that. Yep.
Yeah, I just wanted to address that. We are perfectly comfortable with that report. We think it's a vital piece of information, but I would like to see the under penalty of perjury stricken. My concern is it's fine to sign it, and I am not a criminal law expert by any means, but that does bring in a connotation that I think is troublesome. In my little bit of research I did, penalty of perjury carries a 10-year imprisonment. And without seeing what the report even looks like, I just think that is going to cause pause to the residential service agencies. And I think that we get the same information without somehow also making that language become standard for every report. So I would respectfully ask that we just stricken penalty of perjury.
And I would actually second that because we're asking for an average, and so we to your point, we are we're creating a report that has not existed before. So
I'll move to amend the amendment since Dana can't move.
Yes, thank you. Do I have a second?
Yeah.
Thank you.
Second.
Thank you. And Delegate Lewis, go ahead.
Thank you, Madam Chair, and good morning, everybody. So I have noticed there are a number of residential service agency related bills before us this session. I have really absorbed the reality that residential service agency workers are not really included in the statewide commission on the healthcare workforce that's currently being studied. My understanding is we're not going to learn a lot about this cadre of health workers in that study. And it seems like as a result, we've got a number of piecemeal RSA bills that are all trying to get at the questions of, for example, like Delegate Hill just said, the business model. We're trying to get at the simple information about the number of personal care, home care workers. We're trying to understand wages. The question of wages really reminds me of my professional experience before coming to the legislature, where we did, periodically comprehensive salary studies or studies to evaluate the compensation and benefits that were offered to various levels of worker in the companies where I worked. And it just seems like that's important. It's done in the for-profit sector and in the, parts of the nonprofit sector. It's a standard thing. So we're trying to put all these piecemeal solutions together for RSAs and home care workers. We're not asking questions in the statewide commission on health workforce. I'm just wondering I have a lot of questions, and I'm just wondering if we might be missing an opportunity this session to consolidate what we're trying to do for RSAs and home care workers. I mean, and so my question is, can we think about, I don't know what the solution is, but I just feel like this piecemeal approach is not going to get us where we want to go. I'm really concerned that we're going to look up this time next year and we still won't have a grip on the personal care worker question and the RSA business model. So I actually had a thought in my fevered brain late last night as we're sitting in committee that we should ask the statewide commission to take up some of these questions. And I know that was your bill, Madam Chair, and that work is so important, but time is a wasting, and I worry that we're not going to be where we need to be on these questions with this industry quickly enough to address the needs of the people of Maryland and the workers. That's my editorial diatribe for the morning. Thank you.
And I understand your point. I mean, we have a number of RSA bills, and I think, I will say that Mr. Rodwin and Ms. Kaufman have been working in good faith to try and get to reporting that will be meaningful and useful. In terms of the Workforce Crisis Commission you're talking about,
yeah,
we can make that ask. I was not actually the sponsor of that bill, so I don't know as much about that one.
Sorry, it's a good bill, so I just assumed it was yours. Sorry.
Oh, that's very generous of you. Thank you.
Mr.
Rodwin, go ahead.
That commission has been, though it's not focused on, it's really focused on the entire sort of healthcare workforce, and I wasn't sure whether or not they were going to include home care workers. So I've joined the data subcommittee, and I've been working hard to make sure that the data subcommittee focuses on home care workers in addition to, nurses, LPNs, and the whole healthcare workforce generally. So I think they ultimately, whether or not the workforce was specified in the bill, hopefully anyway, I hope will include some discussion and focus on the home care workforce as well.
And Mr. Rodwin, following that logic, will this report be something that you can take to that commission to look at the data capture so that we can identify the holistic, business model that we need.
Yes, and there's two things in it that I think are really, really important. One is getting data on this publicly funded workforce in terms of how much they're being paid. This is something that's come up in previous years, and it just didn't get across the finish line. But this is game changing to get data to the state about how much these publicly funded, Medicaid funded home care workers are getting paid in terms of their wages. And that's so important to empower policymakers to make informed policy about Medicaid reimbursement rates. And second, updating, a lot has changed since 2018 when the last rate study was done on this Medicaid, this sector of the Medicaid funded care industry. And a lot, I think, needs to be updated. So I think having with inflation and just changing, numbers of workers, et cetera. So I think updating that rate study, making sure that rates incorporate all the actual costs that RSAs incur when they provide care is, I think, also going to be incredibly important. So I think both of these things will help meaningfully inform policymakers to help address the healthcare workforce crisis with respect to home care.
Thank you. And thank you very much for the point, Delegate Lewis. Dana, you had your hand up. Do you want to add to that?
Just real quick. The commission is divided into subgroups or work groups. And I do know that there is representatives from home care serving on each of those work groups to try to make sure that the information and their industry stays at the forefront.
Thank you so much. Delegate Lewis, did that answer your questions or your concerns?
It helps, but I know we'll be back this time next year. And I hope we have the information we need to do something impactful. And let me also, if I may, Madam Chair, thank Ms. Kaufman and Mr. Rodwin for their work. They've been incredibly, responsive and helpful to me with the 2 RSA bills I've been working on. And I just appreciate that. So let's just keep plugging away. Thank you, Madam Chair.
And we'll make sure that we work through the interim. We won't wait till we've got 90 days to fix it. So thank you. Delegate Rosenberg.
I would just suggest, that some form of communication from the subcommittee, the full committee preferably, that says these are issues we want the parties to address. That can take the form of uncodified language in a bill that's going to pass. It can be a letter from the chair, but I think that puts everybody on notice that this is of concern to the subcommittee, the full committee, and everybody is responsive and then gets back to us and advances the discussion for this time next year by some formal communication, whether it's in a bill or in a letter from the committee to the relevant parties. So thank you.
Thank you. And let's vote this bill, and then we'll have a discussion on maybe if the subcommittee would support us asking for a letter from the chair and from the committee. So we are on the amendment.
Move the amendments.
Second.
And this is including striking the penalty of perjury language. All in favor of the amendment, say aye.
Aye.
Aye. Anyone opposed? Go ahead and raise your hand. Delegate Lewis, Delegate Rosenberg, your hands are still up.
Oh, sorry.
No problem. All right, those pass unanimously.
Move the bill as amended.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor, say aye. Aye. Anyone opposed? Go ahead and raise your hand. All right, it passes unanimously. I'm going to go a little out of protocol because I don't know exactly how to do this, but I do want to put it to the subcommittee. Would you be comfortable with my talking to the chair about a letter to make our will known?
That's the right way to go.
We want this to be a priority. All right. All right.
And thank you, Delegate Rosenberg, for suggesting that. Thank you so much.
Pleasure.
So I will talk to the
Thank
chair.
you.
We will get that drafted. I would just ask, let us do it after crossover. So, okay, perfect. Thank you. All right, so that bill passes unanimously. We're going to go to House Bill 870, Division of Rehabilitation Services and Developmental Disabilities Administration Memorandum of Understanding. Aaron, if you can talk us through the bill.
The bill requires the Division of Rehabilitation Services and the Developmental Disability Administration to enter into a memorandum of understanding that includes a data sharing agreement for the medical and psychological records of mutual clients in order to expedite decisions regarding eligibility for services. There were no amendments.
Thank you. And this was the bill Delegate Guyton brought forward. It seems that it's about updating that memorandum of understanding just to make sure that we can get services provided more expeditiously. Can I have a motion on the bill?
Move the bill.
Second.
Any discussion, any concerns? All in favor, say aye.
Aye.
Aye. Anyone opposed? Go ahead and raise your hand. All right, 870 passes unanimously. Thank you so much, everyone. We are going to go now to House Bill 1148, Behavioral Health Care Treatment and Access, the Behavioral Health Model for Maryland. Erin, go ahead and walk us through the bill.
So we've met on this bill twice already. This is.
I was going to say, actually,
third.
we're just talking about the CCBHCs today.
Right.
My apologies.
No, that's okay.
So,
I sent a reprint of 1148, which incorporates the amendments that have been discussed thus far in the subcommittee. The last piece of the bill that needed worked out was the provision regarding the certified community behavioral health clinics. The department and some of the providers were just not seeing eye to eye on how that part of the bill read. There has been, and I sent also an amendment to Senate Bill 362. So that bill is in itself the provision in House Bill 1148 dealing with certified behavioral health clinics. So the provision in 1148 mirrors exactly Senate Bill 362 as introduced. So the amendments that I sent on Senate Bill 362 represent the agreement that the department and the providers have come to and how to move forward with certified community behavioral health clinics. So if you look at that reprint to Senate Bill 362, this is how 1148 would be proposed to be amended, that same part. So the entire section, the new language that was in the bill regarding certified community behavioral health clinics would be stricken and replaced with the following. It would require the Department of Health to apply to the Substance Abuse and Mental Health Services Administration at the Center for Mental Health Services for federal planning, development, and implementation grant funds related to certified community behavioral health clinics for fiscal year 2025. And then it requires the Department of Health to apply to the Substance Abuse and Mental Health Services Administration at the Center for Mental Health Services for inclusion in the state certified community behavioral health clinic demonstration program for fiscal year 2026.
thank you. Thank you, Erin. Delegate Chisholm, go ahead.
And I move the amendment so we can.
Oh, yes, thank you. Move the amendments. Do I have a second?
Second.
All right. Amendments have been moved and seconded. Let's go ahead and open it up for discussion. Delegate Chisholm.
I just want to make sure I've got this right, Aaron. I'm looking at SB 362, the actual bill that I'm looking at. I don't see any reprints, but this is the bill that we're, with the amendment we're working off of.
So if you look at the first page of 362, you'll see section 1 and section 2.
Yep.
This is the reprint we're working off of because this was the only sort of unresolved piece of 1148. We had already worked on the commission piece. We had but this was the outstanding question was the CCBHCs. And if you look at section 1 and section 2, that's of the Senate Bill 362 reprint. That's the new language that will be in the CCBHCs section of 1148.
Okay. Thank you. That's all I needed.
You're welcome. And just Again, the 30-second elevator speech is essentially we're giving the department a little more time because they want more time to do this application for the federal matching grants, which is that enhanced federal match. But we also are giving them some level of flexibility to make sure that the CCBHCs stay as a priority within our 4-year bill. Delegate Hill, go ahead.
Thank you. I'm sorry. I'm just trying to be clear. I'm looking at our 1148, and I'm seeing all the changes we made to the commission. I'm not clear what this Senate bill language takes the place of. What do we suggest?
On your do you have a reprint of 1148?
I'm looking at whatever you sent, and I'm not.
Okay, look on page 14 of the reprint, starting on line 13.
Yeah.
That is the section
141.5.
Correct.
Yeah.
That's
So
the section on certified community behavioral health clinics, the new language. So the proposal is to strike that section, the new language, and replace it with the department applying for the implementation of grant funds in fiscal 2025, and then for inclusion of certified behavioral health clinics in the demonstration program in 2026.
And most of what's in 1148 is defining, right? Until we get down to page 15, line 4. Is that right? And
Correct.
Right,
Correct.
right.
Right. So this is really
it's the
taking the
definition
place
of the certified behavioral of the federally certified behavioral health clinics. That is correct.
It's not, so it's taking it out of like putting it all in statute, and it's instead
Right.
just directing the department to apply for these.
To apply for it.
right. And so the establishing standards, we're not going to do that. No
No.
prospective payment rates,
No,
nothing.
We don't need to do that because that that definition for the federally certified behavioral health clinics, it's already the federal standard. So we're
And the
directing the
establishment
department
of
to
quality
apply.
incentive pay, we're going to take the federal quality incentive payment system. That's referenced in 6. This takes the place of 16 also, page 16.
yes. All
Okay.
the new language under that section is.
And so all the things that we were asking them to do, you're saying that just by applying to the 2 federal agencies, all that comes with.
Yeah, and
I was going to say, let's go ahead and
Yeah.
let Lori Doyle speak to this because she's our CCBHC expert.
Thank you, Madam Chair, and thank you, Delegate Hill. Yes, this was a back and forth with the department around the CCBHCs. I think we all wanted the same thing, which is to implement the model. The question was when and how best to do that. And they felt that they needed some time to ramp this up. This is a model that's federally designated, so the issues that are outlined in the statute that are being struck are already existing in federal law. Now, there may be some things around incentive payments that we will have to work out down the road, but the biggest hurdle is just getting us the model, getting us on the ground floor with this model, and also taking advantage of the enhanced federal match in the demonstration program. So this is a major game changer for behavioral health and one that I hope you can support. Thank you.
Thank you, Lori. Yeah, Delegate Hill, does that answer your questions?
I believe so. Thank you.
All right, thank you. Any further discussion on the amendments? All right, all in favor, say aye. Aye. Anyone opposed? Go ahead and raise your hand. Do I have a motion on the bill as amended?
Move the bill.
Second.
All right, it's been moved and second. Any further discussion? Thank you. All right, then all in favor, say aye. Aye. Is there anyone opposed? All right, House Bill 1148 passes unanimously from the subcommittee. Thank you all so much for your work. This was a big comprehensive bill and it will be a game changer for our state. So now we just have to get it to the floor. We have two more bills, 1153, House Bill 1153, Behavioral Health Programs, Residential Programs, Food Service Facility Requirements. Erin, if you can talk us through.
There's been a reprint to this bill that's been provided. It incorporates amendments offered by the bill sponsor. If you look at the reprint, page 3 after line 31 requires the Department of Health to adopt regulations that establish food service facility standards that are appropriate to residential programs that have fewer than 17 residents and are licensed under specified provisions of COMAR.
All right, just for the reminder of the body, this was our substance use sober house that came and said that they had different standards than everybody else. So we're trying to make sure that they have the same requirements as everyone else. Let's go ahead and move the amendment.
Move the amendment.
Do I have a second?
Second.
All right, and let's go ahead and open it up for discussion. Delegate Chisholm.
Thank you, Madam Chair. I understood why this bill came in and it makes sense. It's a good bill. I guess my question is, we're now going to let the department establish new regulations. Is that right, Erin? And do we know when that's going to come? And that's for anybody with fewer than 17 residents?
The department's on the call, so I think we might as well just let them, they have the expertise here.
Megan Peters, do you want to speak to this?
Hi, good morning.
Good morning.
Yes, we would be developing regulations internally on this for the deadline in the bill.
Okay, so it's essentially, you're just going to make sure that a lot of times these Alcoholics Anonymous, halfway houses, whatever it might be, just making sure that it's safe.
I gotta mute.
And that's why you guys are going to establish new rules for those houses that are 17 or less, correct? Am I correct on that?
That's correct.
I just don't want it to become overly burdensome to some of these houses that are essentially just mom and pop type houses trying to do what's best for the community and host these type of, I guess, programs.
Yeah, the goal of the regulations is to keep that in mind and keep it not burdensome on them.
Excellent. Thank you.
Thank you, Delegate Chisholm. Any further discussion on the amendments? All in favor say aye. Aye, thank you. Anyone
The bill is
opposed?
amended.
Bill's been moved. Do I have a second?
Second.
All right, any further discussion? All in favor say aye. Anyone opposed? Go ahead and raise your hand. All right, it passes unanimously from subcommittee. Delegate Hutchinson, good bill. All right, our last bill today is House Bill 1272, Maryland Insurance Commissioner Enforcement, Specialty Mental Health Services and Payment of Claims Sunset Extension. Erin Hopwood, if you want to walk us through the bill.
This is an emergency bill that extends the termination date for provisions of law that require the Maryland Insurance Commissioner to enforce clean claims laws for the Administrative Services Organization that administers the Medicaid Specialty Mental Health System, which is Optum, and subject them to certain clean claims requirements and specify certain actions the insurance commissioner must take regarding enforcement of the clean claims provisions. The termination provisions would be extended for 2 additional years to May 18th, 2025.
Thank you, Erin. This was the bill hearing that we had yesterday. Just a reminder, this is just making sure that the Maryland Insurance Commissioner, the Maryland Insurance Administration can continue their enforcement of Optum. This was requested by the provider network, and there are no amendments. So if I can have a motion on the bill.
Move the bill.
Second.
Second.
All right, it's been moved and seconded. Is there any discussion? All right, all in favor say aye. Aye. Anyone opposed? All right, it passes unanimously from subcommittee. Thank you all so much. I'm going to give you 20 minutes back before caucus for some folks. And make sure if you are floor lead today on a bill that you go up to the committee room and get your floor report. There are also donuts and mini donuts in the committee room. as a thank you for you all coming in so early. Thank you for the hard work that you're doing. Watch your email and text because we may have a couple more meetings because there are still some things moving through. And we're going to try and get as much work across the threshold as we can. Thank you all so much for all your hard work. And with that, can I have a motion to adjourn?
Move to adjourn.
Second.
All right, it's been moved and seconded